And welcome to the Dr. Bob Show. Every time you exercise, every time you get 7.5 hours sleep, every time you eat properly, every time you have laughter in your life, you're helping to prevent disease. That's preventive medicine. We'll be spending most of this show talking about immunizations. What type of immunizations do you need? Is it the flu shot? Is it the pneumonia shot? Is it the new pneumonia shot? How often do you need your tetanus shot? Is there a meningitis shot? There's so many shots. Which shots do you need? My guest is Dr. Martha Buchanan, head of the Knox County Health Department. And is she ever sharp? She's going to be teaching us what immunizations we need. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about how exercise actually protects your heart and what are some common causes of hoarseness. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Martha Buchanan, the head of the Knox County Health Department. We're going to be talking about immunizations and how they can help you and me stay healthy. Martha, welcome to the Dr. Bob Show.
Thank you so much for having me.
Tell me about the flu shot. I hear more questions on the flu shot. Number one, do people really need it?
Oh, absolutely. People need a flu shot every year. Because the flu virus changes every year, and so every year it's new. So it's really important. 36,000 people die from the flu in the United States every year.
Wow, 36,000 will die of the flu. So the flu shot keeps us hopefully from getting the
Absolutely.
flu. Why do we need to get it every year? Can't you just get it a year and wait a couple?
No, because like the virus changes. It makes small changes every year, and so every year the new vaccine is slightly different than last year's, and so last year's vaccine is not going to protect you this year. You got to get another one. We haven't come up with the technology yet that will allow us to create a flu vaccine that's one time like lots of other vaccines are.
Is there a certain time of year that we need to get the flu vaccine?
Well, now, we used to say wait, but now we say get it as soon as it's available, because you want that immunity. It takes a couple of weeks for your body to develop immunity. So you want that immunity so that you're protected the first time you get exposed to the flu. Because if it's too close and your body's not developed immunity and you get exposed, you're going to get sick.
So if it's available in June or July, you don't need to wait until October.
You don't need to wait till October. It's never available in June. I've never seen it available in June or July. Usually it's September when we start seeing it.
Yeah.
So that's a fine time, close enough to flu season to protect you.
How long does it take the flu vaccine to start developing immunity for the people to have it?
It takes a couple of weeks for our bodies to develop that immunity that protects us if we get exposed to the flu. Sometimes people think they get the flu from the flu shot, but that's just activation of your immune system doing its job, kind of making you feel achy, maybe a little feverish, and your arm's going to get sore. But that's just the flu shot doing its thing, creating your immune reaction to protect you.
Yeah, and so it's working, that, but you don't get the flu with the flu shot. It's
You can't.
an inactivated virus.
It's a killed virus, so you can't get the flu from it. The mist is an inactivated virus, so we've got two formats now.
So are there different types of flu shots?
Well, there are different types of flu shots, and there's so many of them now because they keep coming out with new ones. The most common ones are the ones called quadrivalent. They have 4 different types of flu virus in them, 2 A's and 2 B's, to match the ones that are circulating in the community. And then the trivalents are still available. That's only got 3, so it's got 2 A's and 1 B. And then there's the mist that is for children age 2 to 49. You got to be healthy to be able to take it, so you can't have asthma or any other chronic medical condition. And that's just a little mist up your nose, a lot easier to tolerate if you're a kid than a shot in your arm.
Yeah, last year they didn't recommend the mist. It gives you a little bit of the flu, is that right?
It doesn't. Again, it's inactivated, so it doesn't give you the flu. It can't give you the flu either. It's altered so that it can't reproduce in your lungs, which is where you get the flu, but it can make you have immune response. And it's back available now. They've looked at the data, and they're recommending it for children. And I know moms and dads are happy about that because it sure is a lot easier than a shot.
Yeah, and to tell your child that you're going to get a little spray in the nose is a lot better than you're going to get a shot in the arm type situation. Other immunizations that are important. Let's talk about the pneumonia shot. I hear a lot of questions on the pneumonia shot. Which one? Are there more than one? So let's talk. What is the pneumonia shot? And does it keep you from getting pneumonia?
Well, it only keeps you from getting certain types of pneumonia. So there are several different bacteria and viruses that can cause you to have pneumonia. The pneumonia shot only protects you against a limited number of those. And there are currently a couple of different pneumonia shots available. And the guidelines for pneumonia shots are very complicated, actually, based on age, illness, whether you've had your spleen removed. So it's a conversation to have with your doctor. The only group that is a sure bet who need one of each are people over 65. If they're healthy and they've never had a pneumonia shot, they need one of each spread out by a year. Preferably you get the PV13 first and the one with 23 in it second, but you don't have to do it in that order.
So these are both, the pneumonia shots are both against strep pneumoniae, and one of them has 13 antigens and the other one has 23. So, and the important thing I think is be sure you don't get one right after the other. You have to wait a little bit.
You do have to wait. They prefer you spread it out by a year.
And why is it important? If it doesn't keep you from getting all strains of pneumonia, is this a very common kind of pneumonia?
It is a very common kind of pneumonia, and it can be very dangerous. People end up in the hospital, even people pass away from pneumonia as well, especially folks who are older, which is why we recommend it for folks who are 65. As we get older, we're just more susceptible to those pneumonias, and strep pneumonia is very, very common. It's the most common kind of pneumonia, why they developed a vaccine for it.
So now we've got a flu shot that we take every year, and now we've got pneumonia shot. There's two of them. We talk with our doctor about it and see which form of the flu shot we need and how frequent and at what age. Let's go to tetanus. We always heard from a long time ago, tetanus toxoids or tetanus shots, or now there's a Tdap and there's different combinations. Tell me about tetanus.
So most of us, when we're young, we get the tetanus and diphtheria together. So we get that series when we're young, and as we get older, we got those tetanus boosters, TD. Nobody ever likes them because they seem to hurt more than all the other vaccines. But that protects us against tetanus, and you need that every 10 years. If you are in certain occupations, you need a little more often. The Tdap, which is the one you talked about before, has pertussis back in it. What we saw was we had little children getting pertussis from their grandmas and grandpas, or moms and dads, or even their big brothers and big sisters whose immunity had waned. So
now the pertussis is whooping cough.
Whooping cough, yes.
So if you gave the pertussis vaccine to a child and it worked well, they may lose their immunity later on?
Yeah, and they get sick, but they don't get too sick. They just have an annoying cough for several weeks, and everybody thinks it's allergies. But then they give it to their younger sibling who's really at risk and might end up in the hospital and might even die from it. So we are now vaccinating adults. You just need one in your lifetime. We also recommend it for pregnant women because you don't want to give it to your newborn baby. So
there's lots of concrete recommendations. How do you find out? Do all the doctors have those at their office? Can you get it can you Google it, CDC, or do you call the Knox County Health Department?
Those are all possible ways to find out about it. Most doctors do keep vaccinations and know the schedules or have them posted on the refrigerator. We've all seen them in the offices. We're a great resource. We have immunization clinics. Happy to do that. Anytime a friend of mine asks about what vaccines they have, I give them the phone number to call because I can't keep it all straight. And so we have a travel clinic, not for routine. They do routine immunizations, but also if you're going somewhere, we can vaccinate you. And you can look on the CDC's website, but it's a little confusing. You might want to talk to your doctor.
And that's a whole different story when you're going out of the country because you've got new type of bacteria or problems that you're exposed to. And so you have to prepare for that so you'll stay healthy. Just a foolish question. What do you think the world would be like without any vaccinations?
Oh wow, yeah. Well, we'd have a lot more childhood illnesses. We'd still have smallpox. around, and children would be dying from smallpox. We'd have children being crippled or dying from polio. We don't have any of those things anymore.
Isn't it wonderful
it's amazing
to be able to use preventative medicines with these immunizations? Now, are there other immunizations that we need to be thinking about, such as shingles and meningitis and HPV? Because if there are, that's what we're going to be talking about when we come back.
Okay.
We want to stay tuned. A lot of information, lots of immunizations that you need, so you stay watching. We're talking with Dr. Martha Buchanan, head of the Knox County Health Department. We've been talking about the flu shot. You need to get your flu shot every single year. Then we've been talking about tetanus, diphtheria, pertussis, the whooping cough. We've been talking about other immunizations that will help keep you healthy, the pneumonia shot. And now we're going to be flipping over to shingles. Is the shingles shot effective?
Very effective. Especially the new shot.
So there's a new one?
There's a new one. There are now 2 on the market, but the new one that's out, 2-shot series, it's about 90% effective, which is really amazing for a vaccine. And anybody who's had chickenpox needs a shingles vaccine. It doesn't matter when you had chickenpox, anybody who's had chickenpox can get shingles. So the chickenpox virus can go dormant in your body, and then it comes back out along a nerve as shingles. It's a rash. It's kind of itchy and doesn't look very good, but the big thing is it hurts.
Yeah, it's painful, burning, stinging. What's after shingles pain? What do you call that?
The post-herpetic neuralgia. And this shingles vaccine is really good at preventing you from having that.
So sometimes people, when they get shingles, it's in a dermatome, a skin location, but afterwards they're left with pain that's really, it's almost like go jump off the bridge pain.
For some folks it is, and it can last the rest of their life. It's really, really debilitating for some folks.
So the new vaccine is called?
Shingrix.
Shingrix, and the old one was Zostavax, and we recommend Shingrix now.
We are yes.
Do you get 1 or do you get 2 shots?
There are 2. Separated by time, I think a couple of months. And anybody over the age of 50 should get a Shingrix. Even if you've had a Zostavax, you should get a Shingrix vaccine, just improved coverage.
I know my children have already gotten their Shingrix, the new vaccine, and Dr. Bob has to go get his quickly because you don't want shingles.
No.
And it's something that prevents that, and especially the post-herpetic neuralgia after shingles pain. So it's effective. Does it hurt?
The shot?
Yeah.
Well, anecdotally, I got told by my staff today that people have complained about the new Shingrix vaccine more than the previous one, that it's just a little more painful.
I think what it's doing, it's working.
Exactly.
And so you know that it's working. So it does hurt a little bit, but if it keeps you from getting shingles, you better jump and dance and have a great time knowing.
It's a lot less pain than post-herpetic neuralgia.
All right, so this new shingles vaccine, what are some other vaccines? How about liver disease? Are there vaccines to prevent that?
Sure. There are a couple of vaccines to prevent hepatitis, inflammation of your liver. One's hepatitis A vaccine, very effective vaccine, to 2-dose series. And anybody who travels and eats food should get the hepatitis A vaccine. And sometimes I say anybody who eats out period needs to get the hepatitis A vaccine, because you can get it. If people might remember that we had a hepatitis A outbreak here in Knox County before my time at the health department related to some green onions. So you can get it eating domestically, not just overseas. So it's a really safe and effective vaccine. So anybody who wants it should get it. There are some other risk groups that people might want to talk to their doctor about. And then there's hepatitis B vaccine. And you and I both know medical care workers or healthcare workers have to get that as part of their routine. And anybody who's exposed to blood and body fluids of patients or somebody who has hepatitis B needs to get it. It's a three-shot series. Again, a very effective vaccine. Some folks have trouble responding to it. They're called non-responders. We're not sure if they don't have protection or if they just don't produce the antibodies. If they were to get sick with hepatitis B, we're not sure if it would work or not, to be honest. It's kind of one of those unknowns. Again, anybody who's worried about getting hepatitis B should go ahead and get vaccinated. Again, it's a safe vaccine. We're now vaccinating children, so most children have been vaccinated against hepatitis B, so we won't be seeing adults needing that for long.
How dangerous is hepatitis, and what is hepatitis?
Sure. Hepatitis is a virus that attacks your liver and it causes inflammation. And your liver is kind of it's the cleaner, kind of keeps your blood system clean and keeps you healthy. And so when it gets inflamed, it doesn't work very well. So those toxins that it's trying to get out of your body that you don't need don't get cleared out of your body, so they build up. And you've heard people talk about yellow jaundice. That's where people's skin and even their eyeballs can get yellow because those toxins come out in their skin and you can see them. And hepatitis B can become chronic, and so you are at increased risk for chronic liver problems with that, even liver cancer with that. So it is really something important to prevent. Hepatitis A doesn't become chronic. It's usually just one time, you get over it. But the one we don't have a vaccine for is Hep C, and that's another one like Hep B. It can become chronic.
I hope that we'll get one for Hep C, because that can be a biggie. I'm getting more and more excited about what we can do with flu shots, with pneumonia shots, with shingles shots, with hepatitis shots. What is HPV?
HPV, human papillomavirus.
So human papillomavirus, is it important?
It's really important. It is the primary cause of cervical cancer and some other types of cancer in both men and women. So it's not just limited to women. We see it most often in women because of cervical cancer and vulvar cancers, but it can also cause some anal cancers in men or women. And it's the one that is responsible also for genital warts that you might see.
So HPV, if you get your HPV vaccine, human papillomavirus vaccine, it'll keep you from getting that illness?
It will, and it's designed to prevent the two most common kinds that cause cancer. And so we're recommending that young people get it, both men and women, up to age 26. There's an age out. If you haven't gotten it by 26, they don't recommend that you get it just because of the nature of the virus.
So I'm almost sitting here saying, why in the world would somebody not get these vaccines? Because they're so important to health to prevent from getting cervical cancer or from getting other types of cancer. Meningitis. We always worry about our young students going to college and getting meningitis. Teach me about that, Martha.
Sure. So there are a couple of meningitis vaccines. Both of them are effective in preventing meningitis. And meningitis is something that's very dangerous. And we see it more often in young people going to college and boot camp recruits. So we want those young people to get protected from meningitis by getting their vaccine. It's really easy. Colleges and universities are now requiring it for entry, so that we're encouraged by that, because Neisseria meningitis is really dangerous.
So isn't it great that colleges require that? Because now you and I have both heard a lot of times where people are afraid of vaccinations because they're afraid of some side effects. In general, we feel like vaccinations are safe, and preventing what the vaccinations do so far outweigh any other possible problem. Is that correct?
Oh, absolutely. Absolutely. You know, the biggest side effects of vaccines are a little soreness where they gave you the shot. You might feel kind of achy. I know when I used to get flu mist when I was young enough to still take it, it made my nose itch for a couple of days, but that's about it.
That's
but
no
it
big deal,
prevented the flu. You know, all the concerns and fears about vaccine, again, there's no substitute for talking to your doctor about that, but if people are concerned, there's so much evidence. We have a whole country full of healthy children who aren't sick, who are doing fine, who've gotten vaccinated.
How about children that had their vaccinations, mumps and measles and chicken pox and all of those? Do they lose some? We're living longer now.
We are.
So do we lose some of our immunity, and we need to be thinking about revaccinating people later on?
Not so far with mumps, measles, and rubella, but we have seen some loss of immunity with the chickenpox vaccine. You know, I grew up with everybody just got chickenpox, but kids now don't see that because we've got the vaccine. But we are seeing some waning of that, so I wouldn't be surprised if we get recommendations for another booster of chickenpox vaccine later in life.
Martha Buchanan, you're a great teacher. I can't tell you how much I appreciate your coming to the Dr. Bob Show to educate people about the importance of vaccinations and making sure that they get those. And if they've forgotten some that we've mentioned on the show, you can Google it. You can Google through CDC. You can talk to your doctor. Those vaccinations are ready. Thank you for coming.
Thank you.
Absolutely fabulous. So if you're not up to date on your immunizations, I've got to get my shingles vaccine. Be sure that you get your vaccinations, that you protect yourself from illnesses. It'll be so worth your time. And now, questions for you that we'll be coming back to. How does exercise really help the heart? It really does. And the common causes of hoarseness, well, it could be we're just using our voice too much, but there are other causes, including cancer. You'll want to stay tuned. I want to thank Dr. Martha Buchanan. Wonderful discussions on immunizations. Be sure that you're up to date on your shots and that you stay healthy. Now, questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob, how does exercise really help the heart? It's a good question because sometimes people wonder if exercise might be putting too much strain on the heart. Well, let's see what exercise does. Number one, when we're exercising, the heart requires a normal blood supply. And during exercise, sometimes if there's not enough blood supply, the heart will begin to develop new blood vessels. They're called collateral circulation. And so the first thing that exercise does, exercise on a regular basis, is creates new circulation to surround the heart. Now, on the inside lining of the heart, the inside of the heart, when we exercise, there's a hormone called endothelial protective hormone, where there is a hormone that lines the inside of the heart and makes it where it's less prone to getting heart disease. So what more could you ask for? Well, when we exercise, it gets rid of, with perspiration, gets rid of a little bit of sodium. Our blood pressure falls a little bit. When our blood pressure falls a little bit, the heart doesn't need to work as hard. So always remember, every time you're doing exercise, you are helping your heart and you'll help that heart stay healthy. Question number two, Dr. Bob. What is the cause of persistent hoarseness? Hoarseness is a problem. We've got vocal cords. The vocal cords have to say taut. They have to approximate each other. Anything that makes the vocal cords where they don't touch each other smoothly can cause hoarseness. Well, what can do that? Well, we call some like a singer's nodule or a preacher's nodule or a teacher's nodule. That's people that use their vocal cords so much constantly, every day, yellers we might even say. They may develop little nodules and that can cause hoarseness. Now, the vocal cords are innervated by a nerve called the recurrent laryngeal nerve. And the current laryngeal nerve can be damaged. It can be damaged by sometimes thyroid surgery, or it can be damaged by sometimes people that are having an enlarged left atrium, part of the heart. Both of those can put pressure on the recurrent laryngeal nerve that can cause hoarseness. Sometimes direct trauma to the vocal cord can cause some damage to the vocal cord that also causes danger. People that have GERD, esophageal reflux disease, the reflux can actually come all the way up the esophagus, all the way to the throat in the area of the vocal cord where early hoarseness is because of reflux disease, laryngeal reflux disease. And people with allergies or with nasal problems, drainage from the back of the throat, postnasal drainage, can also cause swelling and irritation and chronic hoarseness. Sometimes just the aging of the muscles in the back of the soft palate and the muscles that supply the vocal cords. Sometimes with age, they just get sort of relaxed a little bit. When they get relaxed a little bit, then we've got chronic hoarseness. Now, if you've got hoarseness that lasts longer than 6 weeks, it's got to be evaluated. They need to look at your vocal cords. Usually it's an ear, nose, and throat doctor. And they spray the nose where it deadens the nose, and they look down at the top of the vocal cord, and they can see if there's nodules, they can see if there is some type of leukoplakia, if somebody's got cancer, if somebody's vocal cord's not working. So you can get the diagnosis and you can know what's going on. So be sure that you talk to your doctor about hoarseness. Remember, people with low thyroid can have hoarseness also, a thick, hoarse voice. So there's lots of causes, lots of things that can be done. It's usually not cancer. It's usually not something that you need to worry about. That's all the time that we have for this show. Remember, exercise, I think, is probably the most important thing we can do. Exercise relieves stress. It gives us a runner's high. It helps our blood pressure be low. It strengthens the heart, as we've said. So exercise is very, very important. Start that day off with a good breakfast. Eat well. Think about what you're eating. Eat more fruits and more vegetables, more high fiber foods. Use less greasy, fat, fried foods. Make them a ick in your diet. Be sure that you get 7.5 hours sleep. There's nothing like a good night's sleep to make you feel better, to make you perform better, to make people around you perform better, to make you less irritable, less mean, nasty, and ornery. And most of all, what do we like on the Dr. Bob Show? It's that laughter in your life. Be sure you're giggling, be sure you're laughing, tell funny stories with people around you, laugh a lot, and you and your friends will stay healthy.